So what happens to healthcare in Oregon if the Supreme Court strikes down the health law?
We had a health insurance exchange bill that had been passed before the Accountable Care Act bill was passed. So once again, we were already moving down that path. So as I understand it, if the ACA is struck down, if the subsidies go away, if the additional funds go away, we may need to scale back the subsidies that we provide to some of that expanded population that we were hoping to come in, but we will still have an exchange and we will still be implementing our coordinated care organizations. So Oregon has been going through almost a decade-long process of transforming our health system. It's been a real public process, but also led through legislators, and most recently our Governor Kitzhaber, who's been in office since early 2011, has spearheaded an effort to develop something called coordinated care organizations, which is a CCO or CCOs, and there are teams of providers that will be really diverse groups of stakeholders. So health systems, primary care providers, in some communities, public health departments, maybe social service organizations that will all come together and provide care for Medicaid recipients in a coordinated way, physical health, mental health, and oral health care. They also will be paid through a global budget, so they will be paid to enhance health. They won't be paid for the services they provide, but they will be paid to ensure that the population is healthy. So it's really an innovative approach. These are being developed right now. The first wave will be up and running in just a few months here. Oregon has been engaged in this effort since before the Accountable Care Act was being debated, and we will go forward with our CCO implementation even if the Accountable Care Act is struck down. Now, the other piece of that, or the other piece of Oregon's health reform, is the health insurance exchange.
What happens if the health law? What happens if the Supreme Court upholds the health law? Does it make a difference?
Yeah. What it does, it just amplifies what we're doing in Oregon. If the Supreme Court upholds the Accountable Care Act, we will be able to receive additional dollars to move forward with our expansion to the Medicaid population and for subsidies for low-income individuals to receive insurance through the exchange. So it will just enhance what we're doing already.